Hello, my name is Bill Haley, and this is Haley 2024, the Movement's Government Reform Ideas. This one's going to be on healthcare. Now, healthcare has two major reforms within the Haley 2024 structure. We're going to reform how we do regulations, and we're going to reform how we do charity regarding charity in America, because we're going to go 100% away from welfare, so no more government funding of healthcare, and we're going to go to a charity model. So let's get right into it. If you don't know about the Haley 2024 CRA structure, let's go over that real quick. We separate all government power at the federal level, state level, and city level into 30 sectors. 5 in the charity system, 5 in the foreign protection system, 5 in the violent crime mitigation system, and I have 15 others. Let's go over those real quick. The charity system, you have charities, the funding mechanism for charities, which is a mandated contribution. We have a charity assessor organization, the case manager. We have family law, and we have religion. We never regulate religion. It's there for organizational purposes and for fight for religious liberty. The foreign protection system has primary authority at the federal level. The other 25 sectors has primary authority at the state level. The foreign protection system, we separate those powers into diplomatic foreign policy, the diplomats, the commander-in-chief, the military corporations, which is a private military system, the funding mechanism that allows the role of prices to really bring out free enterprise benefits into the military funding, and the military authorization agency, which is a checks and balance system. The violent crime mitigation system, we break that down: law enforcement, the court system, prisons, and we have a couple other ones in there for checks and balances. Healthcare, we have two. We split it into two sectors. One dealing with medicines, one not dealing with medicines. We'll get into that a little bit more in a minute because this is a video on healthcare. But we're quickly going through the 30 different sectors. We got financial, 2 different sectors. Insurance has a sector, food has a sector, education has a sector, manufacturing, human resources, which is labor law, identity, which means ownership and citizenship, environmental, work safety, transportation, media and communication, land and water. All these are different areas of government. We put distinct, elected, top-level leadership per sector. Here are some that directly relate to healthcare. Healthcare is broken down into 2: medicine and some medical devices in one sector. Healthcare, medicines, that's doctors, hospitals, and the like. How we divide that up, that's not really my big concern, but it's such a big sector, we wanted to split that up into 2. We have insurance, that's a separate sector. How the funding mechanism for the poor to be funded, we want them to fund themselves to the largest degree possible, but when they need help, we have a charity system. Never welfare, never government money coming in. Now you can say it's government money because we mandate a contribution to the charity system, but it never touches government. We'll go over that in a minute. Family law, that deals with family law, and that's going to touch on healthcare to some degree. Identity, personal and business, deals with ownership, deals with record keeping, deals with citizenship. Record keeping is going to be key on this. Robust medical records, I'll get to you on that in a minute. Within every sector, in every level of government, we have 12 distinct competitive regulatory agencies. These are competitive governing agencies. These are competitive representative agencies. You choose the one that you want to be governed by. All of them going to have different mission statements, a different perspective on how to be regulated. You pick yours, your neighbor picks theirs, the guy down the street picks theirs. There'll be about a dozen to pick from on the local level, a dozen on the state level, a dozen on the federal level. Each level of government, federal, state, and local, will have different responsibilities. But these CRAs, most of the stuff's going to be done at the CRA level. Only a very few things are going to have to go to the representative level. So mostly, only the government only your CRA is going to govern you. My CRA is not going to govern my neighbor. My neighbor's CRA is not going to govern me unless we're in the same CRA. Anyway, these CRAs are full governmental units, executive, legislative, and judicial powers. Highly important. On the rating system side, you have all the same stuff, but their main product is not regulations. Their main product is information, high quality information from a wide variety of perspectives. You have 12 different rating agencies looking at things differently. You pick the rating agency that you like best, that you think are giving the quality information that you want to see from the perspective that you want to see it from. Then everybody picks a rating agency, and every rating agency will rate based off their perspective of how they want to see things done. Not how to get there and the end point. Very, very different perspective on what we want to see. What is quality, what is good, what is bad. There's a lot of different perspectives on how to rate something. Let's keep on going. The CRA is the basic unit. You get your representatives from there, you get your governance from there, you get your regulations from there. You get your bureaucracy from there. You get the one that you choose. Your neighbor gets the one that they choose. Okay, I think I went through all these issues here. Very important slide here. No one person can serve in a position of official authority in more than one sector. And there's 30 sectors. You cannot serve in more than one level of government, federal, state, or local. You cannot serve in more than one branch, legislative, executive, or judicial. And you have to be on the CRA side or the rating system side. And the rating system has just as many representative positions and executive, legislative, and judicial systems. As much as the CRA side, the rating system has the same number. So you see how much we take representation, and we split that power dramatically. Not just by 30 times by the 30 sectors, but by the rating system. And then, more importantly, CRAs only govern their members. My neighbor CRA governs their members. So it's not just representation, but who's going to be governing you. It's highly important to know the changes going on here. So, within healthcare, the big problem with what government's doing right now is that they regulate, they fund certain people on welfare, and then they regulate insurance. They regulate healthcare, they regulate FDA type of things, medicine and stuff. They regulate insurance. All that regulation does so much harm by taking away good, different business models. And then the way they fund welfare, it really destroys the role of prices. The role of prices is so important, and the charity system is going to handle that so much better and allow the role of prices to really flourish. Well, the current system does not allow the role of prices to flourish as much through regulations and welfare. Identity and medical records. I have a full blog on that. Look at the robust medical records I have. And the identity sector is going to handle some medical records, keep them secure, and do a lot better than what we currently have. There's a lot of good and bad with current electronic medical records. And the bad is because of government regulations, in my view. There can be a lot better, but right now I think it's not nearly as good as it can be. Accreditations, licenses, education. This is so important in healthcare right now. Who can be a nurse? Who can be a doctor? You have to go through an accredited college, accredited institution, not law schools, medical schools and like, nursing schools. There's so much government control in this. And it's taken away so many different business models, taken away so many different options. We're going to reform that with the CRA structure. And it's going to make it so much better. Regulations and who can be a doctor, a nurse, a medical facility. So many different ways to do it. And this CRA structure, the competitiveness of it is going to allow the free enterprise to really flourish. The government power, the current government power hampers efficient solutions. We need new business models. And the government control hampers new business models. Taking healthcare away from employers. We want to dramatically take employers away from dealing with their employees' healthcare. If they want to I'll give you $10,000 as a premium for your healthcare plan. Here's a healthcare savings account. Great, all for that. No problem with that. But let the employee pick the healthcare plan he wants to. When you allow your employer to pick the different things within the healthcare insurance, you really put the employer too much into that employee's life. We want to get away from employers being in charge of healthcare, because being in charge of health insurance oftentimes means going very far into being in charge of healthcare. This current government power creates thousands of price controls that inhibits the benefits of the role of prices. So the current government creates so many regulations that demolish the role of prices through insurance, through regulations, through accreditations, through so many different things. The competitive nature will bring free enterprise back into healthcare. For the people who think that the healthcare system is bad and they blame the free enterprise system on it right now, they don't understand to what degree the free enterprise system is not in control right now. We have so many controls that it hampers and inhibits the benefits of the role of prices currently. The government power obstructs the development of advantageous medications. I don't want to get into it because this is a long rabbit trail, but do we really want government who is in charge of Social Security and making that last as long as it can to be in charge of medication? If we come up with the medication and the company comes up with the medication to extend the life expectancy from, let's say, 78 to 83, that's going to put a huge burden onto the Social Security because more people are going to collect the benefits for much longer periods of time. Are they going to deny that medication because Social Security cannot handle that much of a budget increase? It's a very dangerous thing to put politicians in control of retirement planning and your medications. Government creates inhibitions, obstructions. They hamper, they lower, they increase, they ban, they entrap, and they decrease individual control. Every one of those words are so important. They definitely hamper business models. They lower and they increase things that should not be lowered or increased. The free market system creates a balance point in each one of these, and government increases or lowers to the detriment of the American people, to the detriment of the whole system. I know you have to really understand each one of those words, and each one of those words, it's a 20-minute rabbit hole I could go down, talking about how it inhibits, how it obstructs, how it entraps, the welfare state entraps people. A single parent with a child that needs heavy medical care. Do you think that single mother could ever go out and get a job and make more than what Medicaid allows you to make before you're kicked off Medicaid? When their child needs to be in the hospital 10, 20 days a year or more? You're never going to get that mother to want to even contemplate working. You entrap her in a life of poverty. I have firsthand experience in somebody saying, if you make more money, you're going to be kicked off Medicaid, and your daughter will not have the medical care that she needs. Firsthand experience. I can tell you as a parent, it's very, very difficult to put in more hours and put more effort into your job and make more money to go over that line where government says, if you make more than this, you don't get Medicaid anymore. Very difficult, and it entraps people into poverty. This is continuous. All these things are continuously compounded by government trying to fix what they broke. So government puts a price control on. They obstruct, they inhibit, they do something. They see that it has negative effects. Do they repeal it? They take away that regulation? No. They double down on it. They try to fix it with more price controls. They do worse. They take something they broke and they break it worse. Drugs and medical devices. Totally separate sector. We want to separate the sectors so we have a better separation of regulations. Separation of who's controlling what. So, sorry about that. Okay. Ratings on everything. The rating system is going to give high quality information from organizations whose sole job is to analyze and rate based off their perspective. And you're going to be able to see 12 different rating agencies from a whole lot of different perspectives. From the charity system, totally separate, from the healthcare system, from the insurance system. The rating system is going to be rating everything from different perspectives. And it's going to give, that whole system is going to give high quality information to people so they can make a lot better decisions, and standards are going to rise. Standards always rise when people have information about what's going on. And when there's negative externalities, significant negative externalities, there can be put some rating floors. Look at that video. That's another 20-minute rabbit hole I can't go down right now. Charitable Distribution Association, that's a funding mechanism. They're going to make sure every area of need, from housing to medical care to education to food, is covered. But they make sure healthcare is covered for the people who need it. The charity economy is going to play such a huge role in healthcare. It's going to play a huge role everywhere, but healthcare is going to be a big part of it. Look at that video, and you're going to just come up with so many different ways that you're going to see that the charity economy can help out with healthcare. Charity assessor organizations. These are the case managers. These are going to be people who are specialized in making sure the people that need help are clued in to the right charities, the right places to get the help that they need. There'll be a lot of organizations, a lot of different sectors that can deal with some of this, but the assessor organization is one of those. They're going to be working with the other sectors, but it's going to be a great resource to get people and the services needed to be matched up correctly. Such an important sector of the economy is charities, caseworkers. Insurance versus socialized healthcare. So insurance is free enterprise way of doing socialism in a capitalist type of way, where you choose your insurance company and another person chooses their insurance company, and they compete on services. So important that you understand that socialized healthcare is a monopoly, where insurance people have to join voluntarily. It's kind of like a little socialist network, but with terms that they have to advertise and have both parties accept. So if it's too much benefits to the consumer, the insurance company is not going to make money. If it's too much on the insurance and no protections for the consumer, the policyholder is not going to get any benefits because too much protection for the insurance company, no protections for the policyholder. Capitalism, free enterprise, allowing CRAs, competitive regulatory agencies, to handle this is going to force both sides to have a good balance. Let's keep on going. And a lot of other videos I have out there, a lot of writings I have on my website, it's going to go into a lot of the issues. I'm trying not to go down too many rabbit holes here. The new system cannot stop a new medication increasing life expectancy to save Social Security money. So the current system, maybe they don't officially look and ask Social Security, hey, can you handle this medication coming out that's going to increase people's life expectancy another 3 or 4 years? And put an extra 15-20% burden on Social Security. But it's the same politicians that make those decisions. The free market works best when hundreds of businesses models are unhampered. We want to have business models unhampered. That's why we have competitive nature of the regulatory agencies. Regulations hamper business models if you go too tight on them. So some CRAs are going to be tight on a business model. Other ones are going to allow a lot of freedom. In different sectors, one might be better than the other. We don't know. But having that competition is going to be so important. Here are a couple blogs I have written. But I want to keep my family plan. Health insurance right now is done by employers. If a husband works for one employer, the wife works for another employer, there's penalties to have the same family plan for the husband, wife, and kids to be all on one plan. The whole system is now set up to separate mother and father, husband and wife, into separate healthcare plans because it's bringing too much into the employer. We need to go away from that. And I talk about a lot of issues in that. Here's another blog I wrote. The government agrees to pay for medical care. Let the games begin. Part 1 of 7,983. Obviously, I have not written 7,983. What I'm trying to say there is, once you get government agrees to pay for medical care, it throws about 1,000 different factors into chaos. Once government plans to pay for something, is a doctor going to take less than what they're willing to pay? The doctor can't just say, I'm going to charge $1 million for a doctor visit. The government has to put a limit on it. Once that doctor puts that limit, let's say the government puts a limit of $100 for a doctor visit. The doctor can't now charge $200 and get it from the government. The doctor's not going to just say, I'll do it for $50. There's no benefit to the doctor because the government was willing to give it to him for $50. Well, you see right there the role of prices of increasing the price for additional services, that's going to be hampered. Lowering the price to get more business, that's going to be hampered too because the government's willing to pay $100. Why would a doctor only charge $50? You can't use price as a mechanism any longer in the role of prices in healthcare. And it's so important that you do. But that's just one simple little game. There's thousands of them that come into play. Economics has thousands of factors. There's so much I can get to and go down so many rabbit holes on that. But once government agrees to pay for something, it sets a domino effect of ruining the role of prices in so many avenues. The FDA, Food and Drug Administration, approving new drugs. We're going to have a dozen of those. A dozen CRAs. Each one having different philosophy of how to do it. With a rating on every medication. Is it safe? Is it effective? So important that we have a better FDA than we currently do. The monopoly of the current FDA, the government monopoly, is so destructive to better, more efficient, and productive drugs at a cost-effective manner. How many drugs are not even attempted because the cost of getting a new drug approved is so high? We are losing out so many good drugs right now because the price to get one approved is so high. Robust medical records. I talked to you about that earlier. I have a good blog on that. It goes into a lot. Take a look at that. That's a 30-minute rabbit hole right there. Another blog I wrote, health insurance being tied to employment causes many problems. If you have a a self-insured company, an applicant comes in and somebody finds out that they have a very sick child with cancer, let's say, and that self-insured company knows that they have $100,000 a year in medical costs, they're not going to want to take on that employee. That's a very perverse incentive, and really hampers somebody getting a job if they have a family member, a dependent, with heavy medical care. We want to get employment away from healthcare. If they want to pay for a premium and just put, hey, we're putting this into a healthcare savings account for you, great. That is about as far as they should go as part of your compensation package. And they can even say you need to have a certain amount of insurance coverage for this purpose. But you have total control over what health insurance you use. But that's all we're giving you. Anyway, that's a rabbit hole, and that's such a big problem right there that look at that blog. The Veterans Affairs Medical, VA Medical. That's socialized medicine. It's much more expensive and a lot less care, a lot less personal care. There's a lot to that. I write a blog on that, but my writing on that is not nearly as good as thousands of articles by a lot of good people out there. You just research that and you'll see there's a lot to that. Price controls are driving up healthcare cost. They put price controls to try to limit the cost. But politicians are not smart enough and know enough about economics that price controls always increase the cost, even when they're trying to keep it down. They decrease the availability and they decrease quality. Price controls are always negative, negative, negative. That's three major negatives. First negative is it increases cost. Second negative is it decreases quality, increases cost, decreases quality, and decreases availability. It puts a major hamper in the role of prices. The role of prices really work perfect in healthcare if you allow free enterprise to rule. When you have government regulations, it really puts a hamper and it has major negative effects. There's a blog on that. And there's a lot of blogs on my economics page dealing with regular economics and how some of the issues surrounding healthcare relate as well. If you do not want the poor to obtain something, mandate that insurance covers it. Anytime you have insurance start to cover something, the price automatically doubles, quadruples, and just skyrockets up. Whenever government is not mandating that insurance covers something, laser eye surgery and the like, plastic surgery, the price drops dramatically. The difference is profound. Look at the writings on that. I have a little bit of writing on that, but out there in the world of articles, there's a lot of writing on the price difference on whether insurance covers it or it doesn't cover it. The Libertarian healthcare policy. I have a little bit on my blog on that. You can look at it. A lot of good information there. But I like my system a lot better with competitive regulatory agencies. Do not expand Medicaid, replace it. There's a big movement to expand Medicaid right now. And over the last decade, since Barack Obama came into office and I think 2009, 2010 passed Obamacare, whatever it is, it had a major emphasis to expand Medicaid. No, we don't want to expand Medicaid. We need to get rid of it, replace it responsibly with the charity system. It's welfare for the poor, but the Medicaid especially entraps people into poverty for many reasons I already stated. A single mother with a child with significant medical issues simply cannot earn enough, or once they start earning more, they're out of the Medicaid and now their child does not have medical care. Unless they get a good enough job that will be willing to cover them. There's a lot to that. I talked about that. I'm not going to go down that rabbit trail again. Okay, a lot more to see on my website, but you see how healthcare has two major reforms under the Haley 2024. Regulations and how do we pay for the poor. Going totally away from welfare, which means no more government funding of healthcare whatsoever. Going to a charity model, or if you earn your benefits, let's say the VA, government should pay for you to have insurance. They give you a healthcare savings account to pay for your insurance. I haven't gotten into that. I'm not going to get into that too much. But if you earn your benefit, you earned, let's say, Medicare for the elderly, the government should be funding. I have a full system to transition away from Social Security and Medicare, but at least they earned their benefit by putting money aside all those years. I'm not going to get into that. Look at that video. There'll be money put there in a good transition away from government control of those. I have a good, responsible transition. So, until the next video.